what exactly you need. So let's begin at the coast with Kevin Mutai. Kevin, what do you expect from you today?
Well, good morning, Dan and Zainab. Sorry, we are live from State House, Nairobi. My colleague and I, Karim Rajana, already set up outside here and waiting for the President, Uhuru Kenyatta, together with his Ugandan counterpart, Yoweri Kaguta Museveni. My colleagues, Victor Kiprop and Peter Wainaina, are set up at the Moi International Airport, whereby Museveni will be received by Kenya's head of state with the state celebrations. And Victor Kiprop and Wainaina will be covering that for you. Remember, this is a visit that comes at an opportune time. President Yoweri Museveni will be in the country to hold bilateral talks with Uhuru Kenyatta, and of course I'm sure the issues that will be discussed in that meeting are the projects that are of great interest between the two countries and the African integration agenda. Remember also there have been issues that have been going on in the country, and just to begin with, a section of farmers in the country have been complaining of accessing market in Uganda, and those are the issues also that we're expecting the maize farmers we are hoping to hear and get the outcome from the meeting between the two heads of state. We've had also issues of the Migingo Island as part that has been going on for over 10 years. Those are the issues that I'm sure the two heads of state will be able to highlight during their meeting here at State House in Nairobi. Also, there's a key concern that we are also understanding that is a political spat happening between Uganda and Rwanda, and I am sure that the two leaders who are here, remember the heads of the President Uhuru Kenyatta has has held a meeting between him and his Rwandan counterpart Paul Kagame to try and address and highlight these issues that have affected trade ties and friendly negotiations between the East African region, which is also a threat to the African integration community. Remember, this is something that in a big way it is all about business, and it's all about boosting business between the countries within the East African community, and it is an agenda that I believe President Kenyatta will also be trying to front and discuss with his Ugandan counterpart Yoweri Museveni on how to ease the protectionist policies that will be able to boost the trade ties between Rwanda and Kenya, and of course Uganda. Remember, the port of Mombasa is also key in this discussion. President Museveni will be touring the port of Mombasa, and if the spat between Uganda and Rwanda will still go on, then of course other countries within the EAC community are going also to be affected. Felix Tshisekedi, that is the president of the DRC Congo, was here, and I'm sure all these issues will be cropping up. If the situation at Gatuna cross-border between Uganda and Rwanda will still remain closed, I beg your pardon, then of course the issue of accessing business from the port of Mombasa all the way to DRC Congo and Rwanda will be affected. All those issues will be discussed from this meeting, where the two heads of state will be holding a bilateral discussion from State House here in Mombasa, and we will be stationed here to cover all that for you and inform our viewers on what will be happening. President Kenyatta will be headed to the Moi International Airport in Mombasa, where my colleagues who are stationed there will be also giving our viewers what we are expecting from their end. As of now, Dan and Zainab, I beg to hand over back to you so that you can be able to go around the country to also gather views from my colleagues.
All right, thank you so much, Kevin Mutai there from Mombasa. And of course, we look forward to the happenings there in Mombasa, where Uganda's President Yoweri Museveni will be in the country. We also have Martin Mwaura, who is in Muranga County, to give us a brief of what is happening from Muranga. Very good morning to you, Martin.
It's a good morning from County 021, Zainab and Dan. Now, as you have said, I just want to give a small brief of what is happening in this county. First of all, I just want to tell you that yesterday evening at the Muranga County Assembly, there was a heated debate, actually a motion where the committee members, there was a reshuffle. That was a motion to reshuffle committee members. The motion that was brought by the majority leader
Thank you very much, Martin Mora, coming to us from the county of Muranga, where we are seeing some leadership wrangles and waiting to see what happens after that. And now let's cross over to the county of Migori, specifically in Rongo, where Bernardo Juang is standing by to give us a brief on what to expect within the next 2 hours or so and beyond when we get into NTV Sasa. Bernardo, good morning. What should we expect from your end?
Well, thank you very much, Dan. Of course, we are here in Rongo town. Remember, we have true stories that we are following up in this region, that is in Migori and Homa Bay counties. In Homa Bay County, to start with, we'll be following this issue of the BBI that is building bridges to unity task force is in Homa Bay County today, so as to get the views of Homa Bay County residents. Remember, yesterday they were in Migori County, and the weight issues that were given priority were the issue of corruption, equal distribution of public resources, and also the issue of unity amongst the leaders. Back to Rongo, that is Migori County, will be having, remember at the beginning of this year, the government through the Ministry of Education said that they will be 100% primary to secondary transition. And of course, of late we've been seeing congestion in school, a school whereby they used to take 200 students, they have been forced to take 500 students, that is the 300 more. And of course, in Rongo here, the public, Rongo County, Rongo constituency residents, and even in collaboration through the support of Rongo CDF, will be having a groundbreaking here, that is a building of constructing a Rongo mixed secondary school, whereby they will be spending 44 million shillings. Apart from that, they will also be going to Kosodo Primary School, where they will do the same, where they will be doing a groundbreaking of a mixed secondary school there that will cost 22 million shillings. And of course, we are following that, and on top of the hour, we'll be having some of the interviews with the locals and also some of the leaders who will be in attendance. Back to you.
Thank you so much, Bernardo Juang. They, of course, will be linking up with him later on just to get a feel and understand what the residents there are saying. We also have Nurdin El-Moge from Mwangi County. Nurdin, a very good morning to you. Of course, we'll be having Nurdin a bit later on. We understand we don't have him at this point. But before we continue with, of course, what is happening from across the counties and the country, at least 15 people have been killed in a grisly road accident in Matu along the Thika-Garissa highway. Now, the Tuesday night into Wednesday morning accident involved a bus that is said to have rammed a stalled truck.
Other passengers sustained injuries and were rushed to hospital where they are being attended to. And we shall be giving you more details as our team gets there to get further details from the police and see how those who are in hospital are faring. It's an unfortunate situation. That is the image of the stalled truck that is said to have, the bus is said to have rammed into as it was coming from Mandera heading to Nairobi. And it's unfortunate that, all those lives have been lost in this incident. You could see how ripped the bus is on the left side, right from the co-driver end coming through to almost midway, actually slightly past midway the bus. What you're seeing is amateur footage which was sent to us. And it's a very unfortunate thing that those killed are said to be 13 adults and a child, and more than 10 others have been taken to Matu Level 4 Hospital to be attended to. And like I said, our team is going to be giving us information on the same.
All right, and of course, away from that, we also have other stories where 6 lifeless human bodies have been found in the Tsavo West National Park. Here is what we know based on the police report. Now, first and foremost, 2 Kenya Wildlife Service rangers were on mobile patrol in Kanga area when they encountered a foul smell in the park at, like I said, Kanga area. Police reports indicate that when they searched the area, they discovered 6 African male adult bodies which were decomposed and naked a kilometer from the main Nairobi-Mombasa highway. Police who found the bodies scattered say they suspect the deceased were murdered elsewhere and dumped in the national park. None of the bodies had identification. They were moved to the Makindu Sub-County Hospital mortuary for post-mortem examination and identification. Investigations are still ongoing at this point. We'll give you more details as more unravels from that incident. Yes, and like she said, our teams are on the way there already following up on the same to see what information comes from there. It's very unfortunate that we're having a lot of death happening in the country, some of which is uncalled for, let me put it that way. Now, what appeared to be an attempt to show that all is well amid the turbulence that has rocked the Jubilee Party, President Uhuru Kenyatta earlier yesterday walked to his Deputy William Ruto's office for what State House described as a working lunch. And sources intimated to NTV the meeting may have focused on the growing rifts within Jubilee. NTV's political affairs reporter Kennedy Mureithi has more on that surprise meeting.
Shortly after officially opening a session of the International Coffee Council at the KICC, President Uhuru Kenyatta walked to Harambee Avenue Annex to the office of his deputy. He found him with several legislators, including Malindi MP Aisha Jumwa, who for a few minutes was left in the DP's office with President Kenyatta as the DP walked out. Within minutes, more MPs, including Majority Leader Aden Duale and Chief Whip Benjamin Washali, were seen rushing into the DP's office to join the two for lunch. Sources inform NTV that the House leadership and other political leaders, including Nairobi Governor Mike Sonko, were kept waiting in a separate room as President Kenyatta and DP Ruto held a closed-door meeting for between 30 to 45 minutes.
And I had lunch, and it was good having lunch with the President and the Deputy President. It's a honor.
Details of the meeting remain scanty, but it has come at a time when the Jubilee boat is experiencing turbulence from within and without. The latest being talk of impeaching DP Ruto from Senate Minority Leader and Siaya Senator James Orengo, and the deepening crack emerging in Jubilee over who will fly the party's flag in the next elections.
We will not allow them a single minute for them to divide the Jubilee Party, to divide the Jubilee government. I dare James Orengo.
According to Duale, The meeting between President Kenyatta and DP Ruto is a clear indication that all is well in the Jubilee Party, and the machinations that impeaching the DP would be easy is a figment of the opposition's imagination. His sentiments were echoed by 16 MPs allied to the deputy president.
We have information that the ODM's agenda is actually to occupy the position currently occupied by Dr. William Ruto. That is the DP's position.
The fight against corruption in this country is all a fraud. It's all a fraud that you target one person. They have seen it's not working. Now they want to come up with an impeachment motion.
The meeting between President Uhuru Kenyatta and his deputy William Ruto at the Harambee Avenue Annex may or may not have calmed the political temperatures in the country right now, as their staunch supporters try to mull over what could have been discussed in the closed-door meeting they held before they joined some of the House membership leaders for a lunch date at the DP's dining area. Kennedy Mureithi, NTV at Parliament Buildings.
And we'll be following up on that story and the intrigues around the politics of the day as we go along the day. Now let's get to our first conversation, Zainab, which you're going to ably take.
First of all, do you know what a human milk bank is?
Yes.
You do?
Yes, I do. You didn't ask me to describe it, but I do.
All right, you do. So, well, the country's first breast milk bank is set to be opened on Friday at the Mwangi Maternity Hospital. It will be the first health facility in East Africa to have a milk bank for newborn babies. Now, this is a new concept of storing breast milk as a life-saving alternative for children with no access to their mother's milk. Between 15 and 40% of vulnerable babies in neonatal units around the world lack access to their own mother's milk, often because of maternal illness, death, or abandonment. Now, according to reports, about 39,000 babies die annually due to suckling complications. It is projected that once the milk bank has been established, which will be happening on Friday, over 10% of neonatal cases will be prevented. And of course, let me introduce my guest this morning for that discussion. I'm joined by Dr. Mary Wayego. She is a neonatologist at the Mwangi Maternity Hospital. We also have Esther Kwamboka Mugusu, is the Nairobi City County Nutrition Coordinator, as well as Dr. is an international non-profit organization. Thank you so much for joining us this morning, ladies. Indeed. So maybe I can start with Dr. Mary. I mean, a human milk bank. What is it about? How does it work? What is the concept behind it?
Thank you for having us. A human milk bank is, you can think about it like you would think about a bank, a money bank. So it's, you have mothers who have breast milk that is in surplus of what their own babies need, and they donate this. It is collected in safe and hygienic ways. It is brought into the human milk bank, where the process, it undergoes processes to ensure safety. And then this milk is, after the processes, it is stored, it's frozen and stored for use in babies who may need it. And this kind of babies are the babies who have no access to their own mother's milk. So key points that I need to bring forth is, number one, is that there has to be mechanisms to ensure safety of this milk, and those have been put in place in Mwangi. So these mechanisms involve, one, screening the donors, so that we usually would have screening questionnaire tools that have been developed to just do sort of like a risk assessment, and then screening mother's blood for conditions that are potentially transmissible through breast milk. And then in addition to that screening, we also have a process called pasteurization.
All right.
So this process of pasteurization is aimed at ensuring that any bugs that might be in this milk are actually killed.
All right.
before dispensing or allocating this human milk to vulnerable, deserving neonates.
All right.
So having said that, it's completely voluntary act of these mothers. Like I've said, it's mothers who have surplus milk.
All right.
So they have already given their own babies. Their own babies are satisfied. They are growing.
There's extra milk.
But they still have extra milk.
All right, and we'll come back to how the women who probably wish to donate milk to the hospital can be able to do that. Maybe let's now join Mary Wayego, who's Esther Kwamboka from the Nairobi County Nutrition, who's the nutrition coordinator. Maybe just tell us, when did you carry an assessment to ensure that this can be viable in the county and in the country as at large? I mean, when did this happen, and before its implementation, was it viable?
Well, thank you, Zainab. So Nairobi City County is one of the counties in Kenya, and under the 4th schedule, it is mandated to carry out the functions of the health sector. So in 2016, there was a call for papers and by the County Innovative Challenge Fund, and this was a project that was funded by the British government, by DFID. And PATH made a call, and it was accepted, and there was discussion with the Ministry of Health to start a formative assessment for us to set up the Human Milk Bank. I would ask my colleague, Minnie, who is the PATH consultant, the organization that won that grant, to be able to take us through the initial steps and how the assessment was done and how we arrived at picking Pumwani Maternity as the center to hold the first human milk bank.
All right, Minnie, maybe you can take us through that assessment.
Okay, thank you, Zainab. Thank you, Esther. So just to say that this process has actually been happening since 2017. When we first got funding from the UK government to establish a human milk bank in Kenya. Now, the first steps of the process was first to ensure, is there a need in Kenya? We need to determine, is there a need and is it feasible? And this is something that actually can be done in Kenya. Remember, there are about 500 milk banks around the world. But in this part of the country, or this part of the continent, other than South Africa, we really don't have any milk banks. So we conducted a feasibility study with our partners, African Population and Health Research Center. And we looked at what, is this, are mothers willing to donate? Are women who have babies willing for their babies to receive donated milk? And what the need is. And we found that actually up to 80% of mothers, when explained what donation is and how it impacts the lives of vulnerable infants, are willing to donate. And even up to 60% were very willing to have their babies receive milk if ensured of the safety of the milk. The other thing we looked at was, what is the need in the country? We found about 44% of babies in the newborn units. Remember, this milk is particularly for babies who are preterm and low birth weight, who don't have access to their own mother's milk. Up to 40% have separated from their parents, from their mothers for varying periods of time. And what ends up happening is either they get delayed feeds or they get alternatives to breast milk, like formula, which are actually quite detrimental to the well-being of the preterm sick newborn. So that was the first phase. We then went ahead and developed guidelines for the country based on best practices around the world. We have engaged stakeholders from across the country, the Ministry of Health, the Nairobi County, and other partners like WHO and UNICEF, to ensure that we have a common understanding and a common goal for what this milk bank is supposed to do and the gap that it's supposed to fill. We then went ahead and looked at Pumwani, looked at where would this milk bank be, where would we set up this first pilot milk bank. And I'm sure Dr. Wego will tell you that Pumwani has a very high rate of deliveries, about 80 to 100 deliveries a day. They have a 150-bed neonatal unit. At any one time, they have about 80 babies in the neonatal unit. 30% of these are preterm, and a percentage of those require actually donated milk. So that is when we settled on that.
Okay, fantastic.
Yeah.
So, Dr. Mary, mothers might cringe at the prospect of, babies being nourished by the milk of other women. But this is not a very new concept in the country. It used to happen before, right?
Yes. Yes, actually, WHO recommends that the feeds for a newborn baby should be human milk. Number one, the mom's own, the baby's mom's human milk. But in the absence of that, for one reason or the other, the next option is human milk that is safe. So that is where we are coming from. Now, your question is, mothers may clinch at the thought of having to,
have the babies
from another mother's milk. So I think what is key is counseling, and if we ensure that we give them information on the benefits. And what has come up from the assessments that have been ongoing and the research that has been ongoing regarding feasibility, what people raise as the issues is how safe is this milk that you're going to give my baby. So, and like I'd alluded to, we have put in mechanisms to ensure that what we are giving is actually safe.
And a question is, will it cost anything?
Now, in terms of cost, the people who will donate are it's actually a voluntary act, and the babies that are going to receive this are also going to receive it at no cost. That is not to say that there's been no investments around that, and Minnie can give more elaborations around that. But to the end user who is the recipient babies, it's going to be actually at no cost.
At no cost.
Yes.
All right. And maybe, Esther, is this meant to benefit infants admitted in the hospital only, or also for mothers who cannot breastfeed and probably are not around, and probably they're working and they would like to come and get some breast milk from the hospital?
Well, I'd like to give a background about the government support towards mothers who are breastfeeding. So we have a national maternal, infant and young child nutrition policy, and the policy actually advocates for protection and support of mothers who are breastfeeding. And I know if you talk about the working mothers, we already have a workplace support policy that is going to support those mothers. However, from what Dr. Wayego told us, we are going to support vulnerable babies. And these are babies who have been born in a hospital and they've been admitted in our neonatal units. Well, WHO has recommended an allocation criteria. And the allocation criteria would first be the preterms and low birth weight who are sick. And then we have well preterms and low birth weight babies. And then we have our well-term babies. And then we have sick term babies.
So it comes with priority?
Yes, it comes with priority. And all these babies, they would be sick. And clearly, as you said in the beginning, it could be because of maternal illness, it could be because of maternal death, it could be because of abandonment or any separation from the mother for one reason or another. Like in our unit in Pumwani, we have babies who are admitted there and their mothers either died or they had complications. They've been admitted in Kenyatta National Hospital because we do not admit mothers in Pumwani. So then we have babies who are there and who cannot benefit. So probably if I talk about our policy, so what does the policy say? We are supposed to protect our mothers against all undue influence. The Kenyan government, and through an act of parliament, we have the Breast Milk Substitutes Control Act of 2012, and this act actually prevents mothers against undue influence on use of the breast milk substitutes. We also have other strategies that are supposed to promote breastfeeding. We have the Baby-Friendly Hospital Initiative, we have the Baby-Friendly Community Initiative, and we have what we call the kangaroo mother care. That is where we have the low birth weight and preterm babies actually put on skin-to-skin contact with the mother so that the baby has the mother's warmth and they can have access to the mother's breast anytime that they want to. And now we have the Human Milk Bank, and the Human Milk Bank is going to be another strategy in this addition. So in Pumwani, we have adopted the Baby-Friendly Hospital Initiative, we have adopted the Kangaroo Mother Care, and we are adopting the Human Milk Bank. And together, this is a strategy that we are calling the Mother Baby Friendly Initiative Plus. And it is actually going to be the first around the globe, and so that we are adopting all this. And together, we are promoting a baby-friendly environment that is going to ensure that all babies, whether vulnerable or not, are going to get access to some human milk, be it from their own mother or from another mother. Something else that we are doing we're doing demand creation. We have had advocacy meetings at many levels. We've had advocacy meetings at national, at our own county. We have created awareness amongst our health leadership, our local leaders, so our MCAs, our county administrators, our healthcare workers, including our community health volunteers, because then these are the ones who are delivering healthcare to the household.
All right.
And then even creating awareness to the community, because Pumwani maternity is in Kamukunji area,
Okay.
and so the communities around Kamukunji, we have really gone out and we have created that awareness, and even within the facility, for all the mothers who are coming either to deliver or to seek antenatal services or any other services, and these are mothers that we have actually sensitized.
Right.
But even our own staff, not necessarily the clinical staff,
Okay.
even our support staff, our security, and everyone who is working in Pumwani.
All right.
Right now, they know how to promote breastfeeding.
Okay,
to
fantastic.
everyone.
And Dr. Mini, maybe you can talk to us about the investment and what you talked. We also talked about having a pasteurizer at the maternity. What is the capacity of the pasteurizer? How much milk can it hold?
Okay, thank you very much, Zainab. So the UK government, through PATH, has donated 66,500 British pounds towards this initiative. Now, this money has gone towards a lot of setting up the structures. It's not just setting up a milk bank. It does not just putting in place a pasteurizer and saying that you have a milk bank. You have to make sure that you, in the same framework, like Esther said, we have breastfeeding support, we have kangaroo mother care, and we have a lot of work that has gone into basically advocacy, establishing structures and systems, ensuring we have procedures and quality control measures in place. So putting up, then of course also setting up the equipment at the milk bank and strengthening the systems that support quality and safety in Pumwani Maternity Hospital. So the pasteurizer that we have is, is specifically for pasteurizing human milk. One may say that when we pasteurize human milk, we get rid of all the viruses and bacteria that may cause harm to a newborn baby. The pasteurizer itself can pasteurize anything at any one time, anything up to 3 liters, minimum of 3 liters, to even up to 10 liters of milk at any one time. So we have, in terms of capacity, the pasteurizer has enough capacity to pasteurize milk, donated milk, that is enough to feed the babies in the unit and even beyond.
All right. And maybe, we live in a society where women, believe in breastfeeding only their biological children. I mean, are we able to change that narrative? Are we heading that way?
And I think actually for our African culture, wet nursing was actually something that was practiced quite a lot in African culture. That sort of stopped due to, of course, the HIV epidemic, and it became very difficult to do so. And so even the issue of, so even when we went out into the communities and we asked them about, is this something that is acceptable culturally? Many women said, we used to wet nurse. I was wet nursed. My relative was wet nursed. This is just a different form of it. So what we have done is ensuring that we have put in place safety measures so that those babies who don't have their mother's milk can benefit from this milk, but this milk is absolutely safe and absolutely quality. So that has not been shown to be a huge deterrent for mothers. And once they are explained that this milk, it's a very altruistic measure. This milk is going to save the most vulnerable in our society. They are very willing to actually donate and receive.
All right, fantastic.
Yeah.
And Dr. Mary, what would you tell a mother who says, why should I donate milk?
Okay, thank you. But just to add on to what Minnie has mentioned about acceptability.
Yes.
Even in Pumwani's community, people who've been there, long enough because they are actually mentioned that before the onset of HIV, that used to be common practice.
Yes.
Mothers within the unit would have who would have a lot of milk would actually, and it was an acceptable practice. So these worries actually came in after the onset of widespread HIV. So for the mother who
why should I do it?
Why should I? So it's actually an act of when we explain to them that it's actually one of the methods that we can use to save babies. you know, to improve on survival. And this is an act of trying to help humanity. Because this is one of the ways that we can actually, breast milk is one of the ways that is been shown to reduce neonatal deaths. So with that in mind, and with that explanation, and anyway, this mother may have, you know, will have excess milk. With that explanation, I think, you know, it's a way of helping and improving survival of the newborns and potentially preventing deaths. That is motivation enough. And in fact, because we've been trying to sort of like speak to the mothers that we have in the unit, it's actually an acceptable concept. Yeah.
All right. And Esther, so we have the infrastructure, we have the equipment at Pumwani Maternity set to be open on Friday. And this is a very new thing to Kenya. Okay, it was a common practice, but then we have structures and measures in place. Have the staff received the necessary training on milk banking and everything that is required to ensure that this is a safe practice?
Okay, we have, so just to mention again, when we were setting up the human milk banking guidelines in the country, which were done again by the national government, because we know that according to the Constitution of Kenya 2010, it is the prerogative of the Ministry of Health to actually develop a health guideline. So for us as a county, we are adopting what the national has done. So the guideline is that we need to have several key technical teams.
Yes.
So at the national, we have a project team that was actually, that recommended and did a lot of consultation before these guidelines were put in place. And then at the county level, we have what we call the County Advisory Committee for the Human Milk Bank, which again, the processes that Dr. Mary Wayego...
Just to hold your thought, we understand that we cannot get your voice at this point. We'll come back so you can get more details from that. We'll be changing that for a while. But Dr. Mini, let's talk about the kind of screening the potential donors go through. Take us through that process. I'm a mother, probably I have extra breast milk and I want to come and donate at the Pumwani Maternity Hospital. What do I do? Where do I start from?
Okay. So the first thing we do is we counsel you. So we have a lactation counselors who have been trained and who are in place to counsel mothers about, one, to understand what the milk is for, who the milk is going to, because that is extremely important to the mothers who are donating milk, and the entire process, what the process entails. And then once we've done that, we ensure that first and foremost you have more than enough milk for your own baby, and you're not giving milk to the milk bank to the detriment of your own baby.
Yes.
And then we take you through a screening questionnaire where we ask you lifestyle questions. Just looking for your risk assessment, any exposure to diseases, any current diseases that you may have, smoking, alcohol use. We want to make sure that we don't have that. We don't have donors who are smokers or use illicit drugs or alcohol, excessive alcohol intake. And then once we do that, then we take your blood for testing. We test for the diseases that can be transmitted through breast milk. That is the HIV, hepatitis B and C, and syphilis. Once you've been cleared and you've been found to be free of these diseases and you've passed the lifestyle questionnaire, then we take you through a process of actually training you how to hygienically express your milk. And we give you a variety of options. You can express using an electric pump, a manual pump, by hand, even if you wish, if that is most preferable to you.
So there's sort of like a bit of a training for the mothers as well.
Exactly. There's a training for the mothers to go through, because hygiene is extremely important, how to take care of the equipment, how to express, and all these things. And the milk is expressed into specific food grade bottles that are specific for human milk. And then once that is done, it is taken to the milk bank, it's frozen. Then we pull the milk. We only pull milk from one mother. So if she's expressed several times and we have all this milk from this mother, we pull the milk, we take a sample for testing, we make sure that this milk does not have pathogenic bacteria, and then we pasteurize the milk. So the milk is pasteurized in a specific pasteurizer for human milk. And then after that, it's tested to ensure that there actually is no contamination. And then it's kept in, again, labeled food-grade containers in readiness for being distributed to the babies.
And how long can it last? in the bank?
From the date of expression to the time of consumption, it can last 6 months.
Wow.
Yes.
All right. Esther, sorry to cut you short. Of course, your mic had gone off. Maybe just continue with the explanations that were giving us.
Okay, you'd asked about capacity building
Yes, yes.
for the healthcare workers. So just to go back to my earlier sentiments that Pumwani has decided to adopt what we call the Mother Baby Friendly Initiative Plus. And this is a combination of 3 strategies, which is the Baby Friendly Hospital Initiative, and the Kangaroo Mother Care, and the Human Milk Bank. So for the Baby Friendly Hospital Initiative, we have taken our healthcare workers from key departments through what we call the 20-hour baby-friendly hospital initiative course that we have a curriculum from the World Health Organization, and in the Kangaroo Mother Care, we have also taken our healthcare workers through that same training. And just to let you know that Pumwani Maternity Hospital is a center of excellence in kangaroo mother care in the region again. And for the Human Milk Bank, we have again taken the healthcare workers and especially the implementing team through the Human Milk Bank banking training. And this is a training that takes them through the processes of the human milk banking and the monitoring and evaluation processes. So all the processes have been described here. So this team has already been taken through. And just to report that this week we have our engineer who came from the UK, from Sterifeed, the company that has supplied us with the pasteurizer, and is actually coming to just check the system and to take the team through the operations of the pasteurization process. And so we are actually conducting the dry run, and we already have our initial donor mothers. And so the process is ongoing, and we had our engineering team trained yesterday, and we have our operations team being trained today, and we are going to have a dry run of the entire process before we have our final launch on Friday.
All right. Maybe, Dr. Mary, you know, when the milk is heated, so we have it in the bank, some might ask, would it lose essential nutrients for the baby?
Okay, so the process of pasteurization is what we call Holter pasteurization. So what happens is that milk in a batch is put in the pasteurizer in different bottles in a tray, and it's heated to 62.5 degrees for a period of 30 minutes, and then it's suddenly cooled, ready for storage after that. Now, there's been studies that have shown that those kind of temperatures are actually what is optimal to ensure that the milk is clear of all the possible viruses or bacteria. But also, it is also the temperature that is optimal for preserving most of the nutrients. So the research has shown that it's only up to about 15 to 20% of nutrients that gets lost during that process. So it's still as good as it would be. It has the proteins preserved, it has the fat preserved, and all the other all the other components of milk that are beneficial. So the reason that this kind of pasteurization has been picked from all the others, you would realize that, for example, milk that we consume in our houses goes through the process of ultra heat treatment. So that has been deliberately avoided in processing this milk.
So it's completely safe.
So it's completely safe. The method that has been adopted for pasteurizing human milk is optimized to preserve nutrients, but at the same time kill all the viruses or the bacteria or any other bugs that might be there. So it's an assurance, because there's been studies pre-pasteurization and post-pasteurization that has actually shown that most of the nutrients that are needed are actually preserved.
And how often can a mother express milk?
So as often that she's able to. So for example, because we have storage capacity, so like in the unit, what we have is that mothers come in every 2 to 3 hours. So as often as she has surplus milk, she can actually give, because we have a storage capacity that is enormous, that is able to store as much as is given to us.
All right.
Yes.
Thank you. Well, Dr. Mini, as a last remarks, maybe why is the human milk banking so very important in this country at this point?
Yes. Generally, it's been a long time coming. Let's just say that the WHO recommended donated human milk for the feeding of preterm and low birth weight infants who do not have access to their own mother's milk. And that has been a recommendation that has been there for a long time. However, what has stopped us from going forward is because we do not have human milk banking facilities that can ensure the safety and quality of this milk and to ensure the process from donation to recipient, to the giving of the distribution of the milk to the infants. So this is actually why now is because we have infants who don't have access to mother's milk. They're receiving breast milk substitutes that are detrimental to their health. And where we are right now, we are looking at the SDGs, that's the Sustainable Development Goals 2030. And our main problem, our main issue with achieving those goals is neonatal mortality. That's the death of newborns between 0 days and 28 days. And we're looking for what are these interventions that we can put in place to ensure that we reduce that mortality to the levels whereby we can say the SDG goals is 12 per 1,000. So 12 deaths per 1,000 live births. And where we are right now is at 22 deaths per 1,000 live births. So we want to reduce this mortality by 2030. And each and every single intervention that can go towards, contribute towards that needs to be encouraged. So it is time. It is actually, we are a little late, but here we are, and we can now confidently start to ensure that we have human milk for all infants. The studies have shown that actually human milk, breast milk, has the potential to avert 500,000 annual neonatal deaths annually worldwide. So imagine,
that's quite a huge number.
It's a huge number. So if we can be able to ensure this, then we will be able to avert quite a number of neonatal deaths.
All right.
Yeah.
Esther, and your closing remarks on why it is so very important.
So my closing remarks would be that as Nairobi City County, we are looking forward to averting the neonatal deaths, just as Dr. Mini has said, because while the national prevalence for neonatal death is at 22 per 1,000 live birth, Nairobi is at 39 per 1,000 live births. So then for us, we really want to turn around this neonatal mortality numbers. And I just want to encourage all Nairobians, come and join us on Friday as we launch our first human milk bank. It is the first in the Eastern Central African region. It is going to be graced by His Excellency, Governor Mike Mbuvi Sonko, and also the funders of this project, that is the British High Commissioner, will be our chief guest. And we're also going to have our CS, Madam Cecily Kariuki, and the COG Chair, His Excellency Wycliffe Oparanya.
And quickly, I mean, are there plans to probably roll out this program in other hospitals within the county, if it indeed is works out well?
Well, we have this funding is coming to an end this end of March.
Okay.
We have another phase of the project that is going to take us now through the actual implementation for the next 1 year. For that 1 year, we intend to just have the project contained within the hospital.
All right.
However, our future plans are to be able to supply other facilities with this donor human milk. We already have people calling. We know that we have neonatal units around the city in both the public and the private hospitals, and even the faith-based organizations. So people are already making inquiries, and so going forward, we should be able to supply that. We currently we are going to have a collection center just in Pumwani for the Pumwani mothers. So we're looking at being a point where we have external collection centers, and probably having a bank that is not just within the unit, but within the hospital, outside the bank, where we can be able to actually accumulate enough milk to share with other hospitals, both in other counties and even in other countries within the region.
All right. Thank you so much. And Dr. Mary?
In closing, I would say that Pumwani has the necessary infrastructure. We have the unit that is set with all the needed equipment, from the freezers to the pasteurizer, and to the human resource that has already been trained on the processes. We also have put in place mechanisms to ensure safety, so our lab is all set with the necessary equipment and the tests. We also have adopted the national guidelines in terms of milk allocation, so we have we have prioritized, like we've mentioned before, so we know who is going to need the milk and who is going to get the milk. And we've also put in place other mechanisms around breastfeeding support, so that it needs to come clear that this is not a replacement to breastfeeding. It is actually a supplementation to supplementation and an alternative to those babies who would otherwise not have access to human milk. So that also needs to come clear, that we've also put in place mechanisms that have been ongoing to ensure that we are supporting breastfeeding as much as possible. But for those few that have a problem accessing human milk, then we are ensuring that we have that in supply. We've also put in place, we are in discussions, and we are also in, the processes are being put in place so that as much as we are getting the milk coming, we are able to also ensure that there is a way that other needy babies within the county that would not have access to the milk can get this. Because the goal, like all of us have said, is to avert neonatal deaths. As it stands, the deaths in Nairobi are actually higher than the national rates. The national rate is 22 deaths per 1,000 births, and the deaths in Nairobi are actually 39. So that is higher than the national rates, yes. So the main aim is to actually avert that. And all these strategies are geared towards that. We already have, in addition to the breastfeeding support initiatives, we already have kangaroo mother care in place. So all these efforts are geared towards reverting those not very good indices.
All right.
Yes.
Fantastic. Well, thank you so much, Dr. Mary Wayego, neonatologist at the Pumwani Maternity Hospital. We also had Esther Kwamboka Mogusu, who is the Nairobi City County Nutrition Coordinator, as well as Dr. Minnie Kibore, who is the Human Milk Bank Consultant at PATH, an international non-profit organization that is also part of the launch that is expected to happen on Friday. Yes. Well, thank you so much, ladies, for coming in that Friday. The Pumwani Hospital will be the first health facility in East Africa to have a milk bank for newborns. It is a concept of storing breast milk, and it will help greatly in reducing neonatal deaths. Well, from that conversation, we also have pictures in Mombasa County, where we understand that Uganda President Yoweri Museveni will be there for 2 days. Starting Wednesday. There's quite some action happening there. President Uhuru Kenyatta will be meeting and holding bilateral talks with the Ugandan president, and of course tour the port of Mombasa. President Uhuru also visited Uganda 2 weeks ago to discuss local and regional issues there. We have President Uhuru Kenyatta, who's already arrived in Mombasa, greeting the leaders there ahead of President Yoweri Museveni, who will be also making his way there in just moments from now. Those are live pictures from Mombasa County, and there President Uhuru Kenyatta has just arrived. Remember, President Uhuru has emphasized the importance of regional integration, as Uganda and Rwanda are important trade partners for Kenya. Uganda. And this also comes in the backdrop of the escalating tension between Uganda and Rwanda, which has led to President Uhuru Kenyatta to engage in shuttle diplomacy on March 11th when he traveled to Kigali to held talks with Rwandan President Paul Kagame. He also stopped over in Kampala on his way back to Nairobi, where he held discussions with President Yoweri Museveni. There you have it, President Uhuru Kenyatta there, just greeting the leaders in Mombasa. He is also accompanied by Deputy President William Ruto, and Mombasa Governor Ali Hassan Joho is also present there. That is the Moi International Airport in Mombasa. And the preparations are still ongoing for the arrival of Uganda's President Yoweri Museveni. And we'll be bringing you more details of the happenings there. President Yoweri Museveni will be arriving any moment from now. The president has made his way at the Moi International Airport in Mombasa. Quite a lot will be happening there. President Yoweri Museveni is on a 2-day state visit in the country. He will be taken on a tour by President Uhuru Kenyatta in the Mombasa port, where they will also hold bilateral talks. All right, and we'll be getting more details from that meeting between the two heads of state that is happening in Mombasa. Even as we continue with our conversation here, well, Dan Mwangi, my colleague, is ready to bring you another discussion which he's very passionate about, mobile banking loans. Dan, I hope you're ready for that. A lot of people are asking quite a number of questions. But before that, let's take a very quick break. We'll be back. Dan Mwangi will be taking us through the second part of NTV Today. My name is Zainab Ismail. Good morning.
Welcome back to NTV Today. My name is Dan Mwangi, and in this hour of the bulletin, we shall be first crossing over to different parts of the country to see what's happening. Like we know, President Yoweri Museveni of Uganda is coming in for a 2-day state visit, and we shall be following that up. Our reporters Kevin Mutai and Victor Kiprop are in Mombasa and are following that up, and we shall be picking up some of the nuggets from there and some of the feed just to see what's happening to get in step with that. But aside from that, we're going to be discussing matters of money, and not just money in the usual way, but talking about mobile loans. How many of you have taken mobile loans? There are so many apps and platforms where you can take mobile loans. Some are offshoots of some of the existing financial service providers, and some are just independent financial service providers through various apps. And the question is, are you sure you're actually taking enough, or you're taking more than you can handle? Because that's what's happening. And I've got a panel in studio. I'm joined by Phyllis Kamau, who's an advocate of the High Court, and she's a corporate, commercial, and regulatory policy lawyer. We also have Robert Masinde, who's the country manager of Zenka Finance Kenya, and Derek Kiea, who's an investments analyst at Saiton Investments. Thank you for joining us. Now, let's just begin with, for the sake of context, to understand where are we with this betting. And just before the show began, we were talking a bit about the different figures about how many people are taking loans online. So I'll begin with Derek, because I think you guys have quite some of those numbers as Saiton. Like, where are we in terms of how many people are taking loans and the likes? And then I guess even Phyllis can jump in after that.
All right, thank you. The issue of digital lending or mobile loans, it's a bit recent, came around about 5 years ago. This has mostly been driven by the interest rate caps that were brought about on our banks. They were capped at 4% above, no more than 4% above the CBI rate. So with this, banks were forced to do away from the risky lending to the common mananchi, and you can see, based on the statistics, then you see credit extension to the private sector went down. And at this point is where we saw all these unregulated digital lending platforms coming in. And as at now, you can see the numbers have grown exponentially. As per the report we were discussing earlier, we see there are about 7 million active borrowers. And of this, you see most of these 7 million most claim to have borrowed on more than 10 platforms. So I think that is where we are right now.
So people have borrowed on so many platforms, and I want to bring in Robert, because you guys offer the service. So for instance, I've borrowed from his app, through her app, and then I come to yours. Is there any kind of information sharing, or is it only at the point when I'll be listed on CRB that I actually know that I'm in trouble?
Actually, you bring in a valid point. The issue of a borrowing is a concern even for us as lenders. And one of the things that we want to enforce in the industry is effective information sharing. So part of doing that is going through the CRBs. And almost all digital lenders who come into the market who want to seriously develop a viable product are part of the CRB information sharing system. What we want to do, however, is to improve it so that it can be more current, because as we have seen, a lot of how the CRBs were set up was fashioned to serve the banks back then. So the kind of data that the banks share, their frequency, the volume, is quite different from what the digital lenders want to share. And the format is also different. So we are in the process of trying to improve that. And it's not perfect, but it's getting there. Because it's in the interest of the lender to ensure that whoever he's lending to is able to pay. At the end of the day, it is the lender's capital that is at risk. And so to answer your question, we have started the process. It's not perfect, and we are working on improving that as we go.
I want to bring in the lawyer. Yes. Are we seeing a regulatory loophole here?
Yes. First of all, I would want to clarify this. The growth in digital lending has been a deliberate result of government policy to drive financial inclusion and extension of digital services. If you look at the policy of the government from the MTP3 on financial services, there's been a deliberate support both from Treasury and the ICT Ministry to drive ICT and adoption of technology to revolutionize financial services. And if you see how Kenyans have taken up into digital platforms to borrow credit, you can see they are being driven by the convenience, the opportunity, the privacy, the availability. And these are some of these consumers would never have accessed loans from the traditional lenders. And this is a very good opportunity. We've been able to entrench and bring these people within credit financing. Besides that, I think it is also not very accurate to say there is no legislation. There is legislation. The way the current financial market, credit market is structured in Kenya, there are deposit-taking institutions and non-deposit-taking institutions. So the policy of the government has been to heavily regulate deposit-taking institutions. We have CBK, we have the Microfinance Act that regulates deposit-taking microfinance institutions. And the policy was that and you know, since 2006 when they put in place the Microfinance Act, the government did not regulate credit-only lenders. These are lenders who just come into the market and lend their own money. This is not public money. They're not taking money from the public. And Section 3 of the Microfinance Act actually allows the Minister in charge of Treasury to put up regulations for credit-only microfinance institutions to regulate certain aspects of the lending. I think where we've arrived, after 5 years of growth in digital lending, we are getting to a point where certain policy issues are arising. And regulation always follows innovation, you know, because you let innovation to grow and then you start to ask yourself, what are the issues in the market? What are the issues for the consumers so that we begin to regulate? And I think where we are in a very good place where both policymakers, industry players are looking at the issues and asking them, what are the issues that we can address? But for the consumer, I think we've come to a point where the consumer is enjoying services, is enjoying the ability to borrow from various platforms, and they can engage and they can make a decision where to borrow. We're also looking at a borrower right now who, because of the entrenchment of these services, now understands financial credit. They can access as little as 50 shillings, 100 shillings, up to and grow their financial credit to be able to loan, to borrow more amounts. So as policy makers, I think it is important that we all come together and discuss how do we then put up policies that are still going to drive innovation.
Okay, and excuse me, and one of the concerns that comes about is with like many other products, the fine print. Mm-hmm. There's the things that people don't read down there, and that is what ends up, you know, just eating you up. So I want to bring back, sorry, Derek.
Yes.
What are some of the things that we see people defaulting on? And I think also Robert will respond to this. So what are some of the things that, you know, the guys who borrow through the apps find themselves having been overtaken by, so to speak?
I think in as much as she mentioned this regulation, there's also loopholes, and I believe there are quite many. You can see banks are not allowed, as of now, they're not allowed to borrow, to lend at more than 13% interest per annum. That this, if you look at how they're dispersing via their apps monthly.
Okay. Sorry, let me just interrupt you for just a bit. I want us to cross over to Machakos, where the county commander is speaking following an accident that happened there and many deaths. Let's just listen in.
Do I go ahead? Yeah, so good morning. I want to tell you this morning we had a very bad accident that involving a bus from Garissa heading to Nairobi. And then here in Matu town, it happened that there was a lorry, stationary lorry, which was standing beside the road. Then it happened that this lorry came, this bus came, rammed into the bus, to the lorry, and then we had people who were fatally injured. There were 14 of them died on the spot, and we had 27 of them who had very serious accidents, injuries I mean, and we have taken them to Matu, here is it level 4 hospital for medical attention. I know there will be, some of them will be ferried to Nairobi for specialized treatment. So this is what happened.
So we understand that the lorry had stalled for 2 days.
No, we haven't established for how long that lorry has been there, but we are told by our officers that it stalled this morning. A few minutes to the accident, that's the time the lorry had a breakdown, a mechanical breakdown.
Have you gotten in touch with the persons who are responsible for the lorry, that's the lorry driver?
Yeah, we managed to arrest him because the driver was there, the lorry driver was there. We managed to arrest him. He's in custody. We are carrying out with investigations. It's also good to know that the bus driver escaped, I think, because of that he had a trauma, and then we're also looking for him. And we'll tell the owner of the bus to summon him to the police if he doesn't come. Inaweza kuwa hivyo, lakini sisi polisi tulikuta kukiwa na hiyo alama ya kuonyesha kwamba kuna gari ambayo imeharibikia barabarani. Sisi tulikuta hiyo ndio kitu tunaweza kuthibitisha.
So mmeweza kujua kama hilo basi lilikuwa imeenda speed kuliko kiasi ama?
Sasa hiyo sasa tutajua baadaye kama kulikuwa ni nani alikuwa na makosa. Hatuwezi sema saa hizi ni basi ama ni lori, kwa sababu bado tunafanya uchunguzi. Baada ya kufanya uchunguzi ndio tutajua ni nani blame, ni nani tutapeleka kotini. Lakini kwa saa huu ningependa kusema ya kwamba uchunguzi bado inaendelea. Tutajua as we go on, tukiendelea ndio tutajua ni nani tutacharge.
Have you established the total number of passengers that were in the bus at the time of?
We haven't established because some of them, wale tuliwapata, wale injured so far karibu wote walikuwa 27. Wengine hatukujua kama walikuwa wameshuka mbeleni ama namna gani, lakini hawa ndio tuliwapata.
Tunaweza kuambiwa wananchi wanasema hiyo lori ilikuwa imesimama hapo tangu jana. Kulingana na nini? Hiyo lori ilikuwa imesimama.
Hiyo ndio sasa tutafanya uchunguzi. Najua bado tumeanza hiyo uchunguzi kama hiyo lori ilikuwa imekaa hapa kwa muda ama ni leo asubuhi, because hiyo story tunapata ya kwamba kwa scene kwamba ilikuwa imestall leo asubuhi. Kama lakini bado uchunguzi inaendelea, tutajua sasa, itatusaidia kufanya uchunguzi zaidi kama ilikuwa imekaa hapa siku 2 ama siku 3. Lakini kwa saa huu siwezi tukasema kwamba ilikuwa hapa siku 2, siku 3 ama ni leo. Hiyo bado uchunguzi itatueleza kwamba as we go on with the investigations, tutajua baadaye vile tutachukua.
Labda tu kidogo, kulingana na lori ilikuwa imesimama kando ya barabara. Kwa nini labda dereva wa basi akatoka kwa barabara atakuja karibu kwa lori? Alikuwa on speed ama nini?
Hiyo sasa ndio uchunguzi itatuambia kama alikuwa na overspeed ama, kwa sababu yeye mwenyewe hatukumpata. Hiyo sasa bado tutajua kama alikuwa na hata speed governor ama namna gani. Hiyo uchunguzi bado itatueleza. Thank you very much.
Mohamed Farah Malim, who's a county commander of Machakos, and he's given some details about that, saying that those who died on the spot are 14, 27 have serious injuries, and they have been taken to Matu Sub-County Hospital, after which some of them are going to be flown to Nairobi for specialized treatment. We pray that they get well soon, and we pray for grace for those who have lost their loved ones. Those are 14 lives lost again. Now let's cross over again to Mombasa and just see what's happening there. We do know that President Yoweri Museveni of Mombasa is meant to be arriving. That might be him in the plane. He's meant to be received by President Uhuru Kenyatta at the airport. This is the Mombasa Moi International Airport in Mombasa, which after which they are meant to head to State House Mombasa for bilateral talks with their teams. After which then they will have a joint press conference, and like we had earlier indicated, that Victor Kiprop and Kevin Mutai are on location and are going to be giving us briefs of what the information that they receive. You can see the Ugandan flag right next to the door, which is very indicative, and this is likely the president of Uganda who has just arrived. And anytime now he should be coming down and received by President Uhuru Kenyatta for a 2-day state visit to Kenya, within which he's meant to tour the port of Mombasa, and keen to see what implications there are, what message is meant to be sent out in regards to this, in regards to the ongoing conversations in the region. You know, the East African region has been having some struggles in regards to the coming together as a bloc, with Tanzania being one of the what has been termed as a problem child of the region. And so we wait to see whether any of this is going to play out, whether he's going to there's going to be any mention of the ongoing strain of relations between Uganda and Rwanda. As we know that President Uhuru Kenyatta had also sought to address the same when he met the leaders at a different function, but out of Kenya. So we wait to see what else is going to be there. Uganda is our biggest trading partner, and so we wait to see what more is going to be benefited, is going to be gained from this visit, and what deals are going to be signed. More often than not, we see various our President Kenyatta going to various countries and signing deals, or having deals signed as he observes and presides over them, in regards to Kenya benefiting. But sometimes we find that Kenya is the one which is going to be getting some benefits in regards to being the stronger partner economically. We are a stronger country than Uganda, and so as the staircase and the door go down, we'll see the arrival of the president, likely to be preceded by his team. That's the flight team that is already coming down, and we can see the security detail is already there in preparation for the arrival, for the coming down of the president and his team, even as Kenya's team is expected to be there. That is the president, his deputy, and others, including the Foreign Affairs Cabinet Secretary, that's Monica Juma, for who this is a big deal. That's President Uhuru Kenyatta there, who's already arrived there, ready to receive his counterpart, who is now coming down the stairs with his signature hat. President Yoweri Museveni and President Kenyatta are now shaking hands as he welcomes his counterpart from the western side of the country, from the western border, and his wife Janet are both here on this two-day state visit. We shall be following up on this because there's a lot to be looked into in regards to some of the trade ties. There's conversations about some of the land island land that has always been a point of debate between the two countries, and now we wait to see what comes out of this. So like I said earlier on, from here, according to the State House itinerary that was sent to the media, they are meant to be going to State House Nairobi, rather Mombasa, I beg your pardon. They're meant to be going to State House Mombasa, after which they are meant to have some trade talks with some bilateral talks, and then from there they shall be having a joint press conference to brief the nations on what they have agreed on and what is going to become of the future of the relations between Kenya and Uganda. So that's President Yoweri Kaguta Museveni alongside President Uhuru Kenyatta, and they are now probably going to have there's going to be a bit of ceremonial activities at the airport, after which they will leave for State House Mombasa, and we shall be following this just to keep you up to date on what exactly the president and the government at large are going to be engaging in and getting into and binding ourselves as a country on our behalf. And so Victor Kiprop and Kevin Mutai shall be following up on the same, even as we follow up on the same. As you can see, as you can understand, the shaky images because of the security barriers that are there to ensure that the journalists not go beyond a certain point, but still at the same time ensuring that they get the perfect picture, get that footage. You could see the red carpets which are there in preparation for some of the ceremonial activities that are there. You could see at the back there's a whole group of people who are standing by and have been waiting for the president to arrive, and then the presidents to then come and take their positions. Let's just listen into some of what is going on there. The national anthems are being played now as part of the ceremonial welcoming of a visiting president. That's President Yoweri Kaguta Museveni, who is now in Mombasa at the Moi International Airport, Mombasa, alongside his Kenyan counterpart Uhuru Kenyatta, as he's been welcomed here for a two-day state visit. And now at this point, I think we could just listen into the national anthem before we continue with a bit more commentary.
toka mbele. Wewe, toka mbele. Toka mbele wewe. Toka mbele.
A gun salute that is going on in Mombasa for President Yoweri Museveni, who is in Kenya, like we've said, for a 2-day state visit. Coming shortly after the Uganda, Kenya and East African communities anthems have been played. And now after that, like I had said, there'll be a bit more ceremonial activities happening there at the airport before the presidents and their teams can head on to State House, Mombasa, for various bilateral talks. Before we get back to Mombasa, let's come back to a discussion in studio. And I cut you short, Derek, sorry. Maybe you could pick up from where you were.
Okay, as I was saying, in as much as regulation is there to protect the consumers, I think education should play a bigger part. This comes in two ways. The terms and conditions of your loans and the consequences of your lack of honoring the terms and conditions. So CBK comes in and says you are not allowed, tells the banks you're not allowed to give loans at more than 13%. The bank says, okay, if we are going to loan out at on monthly basis, this sums up to no more than just above 1%. But if you look at how these banks are lending, they tell you, yes, we'll give you 5,000, interest rate is at 1%. We are going to give you we are going to deduct a 5% processing fee, a 5% rollover fee if the loan carries on into the next month, and so on and so forth. So even if we say yes, there is regulation and the regulation is trying to protect our consumers, I think education should play a bigger part. Now going to the second part of the consequences of the fallout of your lack of honoring the obligation, quoting a statistic that was done from a survey that was done by FSD in around 2017, they gave around 500,000 people who have been blacklisted for defaulting. And I can bet you that majority of these people do not know the consequences of this, and I'm sure in the long run, this is going to come and haunt them.
Okay, maybe you could pick up on that.
Yes, that's a very important point that's been raised, because we as digital lenders grapple every day with the task and the prioritization that we need to give to educating our users. I think in the long run, if it works for them, it works for us. I think that's the basic mantra that most of us have. And however, to enforce this, to put this into practice, we at Zenka have joined up with other digital lenders to form a Digital Lenders Association of Kenya. This is one of those forums which was lacking before, to address the industry-wide issues such as user literacy and creating a certain minimum standard among all the players. So as he has mentioned, there could be regulation, but regulation doesn't always cover everything. I think there has to be a concerted effort and very deliberate initiative among the key stakeholders, in this case being we, the digital lenders, who are the ones who put in the investment, to ensure that the user, who is the person that we are serving, comes out of this on top. So part of the things that we are doing to enforce user education and knowledge ahead of them taking into this obligation. First, let me clarify that, you see, it's a loan obligation like any other, It's just that it's transmitted through an electronic channel that has made it sometimes look different, but the obligations of the borrower and the lender are pretty much similar to any loan obligation. I think what happens here is that because of the expediency of delivering this service, once you deliver this service with efficiency, real-time, online, instantly, sometimes the focus on the terms and conditions and the underlying terms gets overlooked. So one of the things we are doing as an association is to try and create a minimum standard, whereby we say for all our members, let's have a minimum standard of transparency, particularly around pricing, particularly around affordability for the borrower. And affordability means will you be able to pay at the time you're supposed to pay.
And speaking of that, what are the rates we're looking at here? Is it still under the same rate capping law, or is yours a different case?
Well, you know, the rate capping law applied very specifically to the banking sector. So if you're licensed and regulated by the central bank, then that cap came into play and it has been enforced. We are not regulated under the Banking Act, so it doesn't apply to us. And I think the general approach by the policymakers and the regulators is that where you're lending your own funds and you're not taking deposits from the public, the approach so far has been they don't regulate, okay? So because of that, it becomes a private treaty between lender and borrower. And so that's determined very widely. There's no standard rate. It's determined very widely depending on, first of all, the digital lender, the person's credit rating, the tenor at which they're going to borrow, and also the kind of service that the digital lender is offering, which then also translates into the cost of that borrowing. So it is a wide range, and there are now more than 40, so I wouldn't be able to
So what are the ranges we are seeing interest rates? I mean,
you have seen that in recent past, I think it's only digital loans where you have had, where you have found them offering rates as low as 0. I think you've heard that. There's been a promotion where there was...
As an offer.
As an offer.
Yes.
So they can go as low as 0. They can go as high as 30%, depending on what the product is. So it is not standard, and it's impossible to standardize it.
Just to add on this, I think it's very important for us to state that last week the court made a decision regarding the Section 33B of the Banking Act. And if you look at that decision, the court was really saying there wasn't a lot of, the section itself was ambiguous, did not have a lot of clarity on how it applies, and that is why it was set aside. And one of the things the court was saying is the issue, how do we arrive at what a credit rate, how do we arrive at the credit rate that lenders should lend on, okay? Part of it, you know, Parliament thought it was interest capping, but after they imposed the interest capping, we saw how that is now affecting the market. And what the court has done is it has allowed a period of 12 months for the policymakers, both Parliament and Treasury and CBK, to come together and stakeholders and for me, really, it has got to be based on research. It has got to be based on data to determine how do we arrive at interest rates. You see, digital lending, credit-only lenders face a lot of risks. The risk is high because you don't know this customer. Remember, the lending is done automatically. You don't have any customer facing. The guy could even throw away their SIM card, and that was, you know, when it started in 2017, that was prevalent. Fraud is a big issue, yes, where people borrow and throw away their cards, not thinking their obligations will follow them. And because of that risk, then they price their rates accordingly, and that is why, you know, credit scoring is important. That if a customer's credit scoring is good, if they are a repeat customer, then their rate would come down. So as to what this rate should be, as to how it should come down, I think it's where we need a framework. And I was saying, as much as there's maybe fragmented regulation, that the industry is just not operating like a Shylock. I mean, the industry, because they're operating on a mobile platform, the mobile platforms are regulated under the National Payment System and with CA. Okay? Some of the players at banks, they are regulated within the Banking Act. Okay? Some of them are microfinances. They are regulated under the Microfinance Act. So there are bits and bits of fragmented regulation. And perhaps the regulator may now come together and look at now this group of credit-only lenders, and there are certain aspects of regulation that can start. In my view, we could begin with prudential guidelines where we start to look at these credit-only lenders and ask ourselves, who are they? Where are they getting their money? What is their governance structure? Because that is a concern also of the regulator. And then in terms of consumer, what are the issues for the consumer? He mentioned transparency when they are coming into the contract, that they need to know the rates. Okay? That has been clearly pronounced by the Competition Authority. They pronounced that mobile services, the rates and pricing must be declared to the customer. And so perhaps then that is now to be extended and I think by extension it does apply to the credit lenders, the app lenders, but it's not, you know, defined in one law, okay? And then we can look at other aspects of transparency of these credit lenders. Who are they? Where are they getting their money? Who are these people? Because again, you want to have good people investing into this industry so that they don't exploit the customer. Because at the end, if you do have a group of people that have a certain value, then you would expect that the market conduct will be good. Again, as Robert said, self-regulation is important, that the industry can start coming together and having certain standards that are acceptable in the market. The other issue, of course, is on pricing. But as we said, I think now it's a very good time for both policymakers to come and do proper research to back up policy on credit rates and the pricing that should be there, so that we do not exclude a certain group of Kenyans and make it impossible for them to access credit because of certain policies that we can take. And as he rightly said, because of the decision by Parliament to regulate interest rates, the low-end SMEs were cut out from banking because banks were deeming them too risky. Yes. Okay, then the digital lenders have taken up that risk to lend to these people, and they are pricing their loans a bit higher because of the risk they have to bear. Okay, so if this person is providing this service at this interest rate, and the customer understands his obligation and is willing to take up the service, then you see the problem is resolved. Part of it is also consumer information. I think financial literacy is important, and both stakeholders should work to
and a number of times you find the communication still has a lot of jargon. So yes, the common mwananchi may not really understand what they get themselves into.
And I think there is need, and I think actually by the common mwananchi taking up this service, they're also increasing their financial literacy. For instance, many of them did not know about CRB. They thought you could throw away your SIM card and you disappear in the clouds. But now they know that your history follows you because of your ID. When you borrow, what is listed is your ID number and not your line. So when you take another line, your record will follow you. And now if they start understanding how to get themselves out of listing, remember listing doesn't even happen automatically. It takes 90 days of a non-performing loan before you actually get listed.
Yes.
And so borrowers need to understand when you take a mobile loan, yeah, you have the period to repay. If you can't repay it like in a month, you have like 90 days to repay it. And even when your loan becomes bad, you can still go back to the person who listed you and negotiate for delisting or for your credit score to change. So you can still repay it. And then come to a positive rating, and you are able to borrow again.
Okay.
Yes.
I just wanted to add that, you know, in any time when there's a new innovation coming into the market, I think it's inevitable that for some time, a few hazards will emerge. And the danger sometimes is to focus a lot on only those hazards and disregard the general good that has been created. So for instance, the numbers being shown right now, my colleague mentioned 500,000 people listed at CRB. But if you take that in proportion to 7 million users, you realize it's not, you know, proportionately significant, right? And then you also have to remember that that number is largely amounts of about 200, 300. So if you take the value, it's actually even less. It's probably less than 1%. So it's true that there have been more listings on CRB in terms of individuals, but at the same time, we should remember that what is happening here is that these people initially had no credit access. They're having their first encounter with the experience of borrowing and repaying. The other thing that I think that needs to be emphasized on also is that reporting to CRB is both negative and positive. So many of them, the 500,000 who have defaulted, still have a chance of repaying, getting out of that situation, and carrying on. They'll have learned a very vital lesson. When they start borrowing more and they graduate to borrowing from a bank, they'll be better placed, you know. So, but the other sort of 95% or so who are borrowing, when we report to CRB, we also give positive reporting. So their credit scoring is also improving. So there's also a large positive that's coming out of this encounter, even though I can't say, I have to admit that, yes, we have to address the negative so as to keep the industry sustainable. So I think the service that digital lenders are offering to the society at large is providing access to people who did not have financial access before. They may start at 500 shillings borrowing, And eventually, because I'm sure they will not stay there, if all works for majority of them, eventually transitioning them into the mainstream formal sector, which maybe would have been difficult for them to access without this bridging that the digital lenders
Okay,
offer.
and as we, because time is not so much on our side, I just like us to do like a round of closing comments, but I'll sort of like pinpoint what I'd like you to address. Maybe for you, Derek, you can tell us as you close, this money that people are borrowing, especially through the apps, what is it being borrowed for?
I'll quote again the survey from 2017. And although I have to admit, I don't think I'm really one to judge to say what you're supposed to really borrow your money for. But I think there are a few aspects that you can look at and say this is not sustainable. Around 30–35% say they are borrowing for their businesses, which we can say is productive or a productive means of utilizing your loans. But there are also things you look at, you see another 30% saying they are borrowing for their day-to-day livelihood, to sustain themselves from the day-to-day. That means I'll borrow this month, pay back, borrow again next month. Now you see you're incurring costs, and this, again, is not sustainable.
So people borrowing more than they can handle?
Yes, and then there are others who are borrowing, around 10% borrowing to repay loans. Now that is where we go into the red. And then now there was also a unique factor where people say they are borrowing for betting. It's around 5%, but I think that was also interesting.
People are borrowing to bet because they feel it will bring them returns.
It will bring them returns.
Okay, and I just want to bring in Robert as we close also. How do I know that someone is not using my mobile phone? What are the security checks on your end, for instance? Because I know of someone who was unwell, and so when they were unwell, some relatives who had access to his phone took loans. So when he got to a place where he could actually get his phone, he's now paying loans which he has no idea, what security checks are there?
So identity theft is quite a big concern for us as well, because the moment we realize that you are not the real borrower, we have no option but to admit that it was a fraud, and we have to write it off. So the loss is on us. So obviously we try to take every measure possible. Now, part of what we do is when you apply for a loan, there are several authentication measures that we apply. We check your ID versus your actual phone number. We have access to the government IPRS system, which allows you to cross-check clients' details. In some cases where we are not certain, we work with the mobile telco to see if this user has registered more than one phone line. We check with CRB to see if there are other contacts details there, because then we can also contact you to verify. But last and most importantly, obviously, we want to make sure that you are the one. So on your phone itself, I think one of the things that you have to be aware of, and one that will be driven also by the financial literacy drive that we are conducting, is just your own personal guard over your PIN, your own phone security, because now the phone has become an instrument of access to your, to your bank accounts and to your access to borrowing. So the user also has to take those measures, and for those we are using a lot of user literacy campaigns to educate. But on our side, we try to optimize and apply all the measures possible using the third-party partners such as CRB, telcos, and
this is usually, is this before you actually give out the loan, or is it when a suspected fraud case is brought to your attention?
No, it's before, because remember our service is expected to be online, real time, it's automated. So you have to build these checks in an automated fashion, because you have thousands of requests coming in. So you have to be able to request and only spit out or create the exceptions for those that don't fit and cannot be verified. And that's hopefully why you'll catch the frauds. But I have to say, having said that, despite applying all measures, we have a very high number. It is a concern for the entire industry, and it's something we're trying to address. And part of that is coming together as an industry to also increase the level of cross-checks that we can create, across the different service providers.
Okay, thank you. Now I want to bring in the lady, last but not least. And even as you close, what are the things that people need to look out for? By the time I'm going to take that loan on that app, if his app, I've got his app on my phone and I want to take that, what do I need to look out for to avoid being, one, listed, or two, being just caught up in some. Because with online, there's a lot of things you're seeing which, you know, it's an emerging thing. You will see things that were never foreseen because it was never in existence. You don't find yourself in a situation that you become the guinea pig of the country that, you know, this can happen to you. I saw it happen to someone, and then you are that someone. So what needs to be, what do people need to be on the lookout for?
Okay. Consumers need to really look at transparency. Before they take a loan, they must make sure that they understand the rate that or the costs of this loan, that it is disclosed, whether it is 7.5%, whether there is just a loan or there is a facility fee, the total cost of this loan. Because then you can make a decision whether it is worth you borrowing or not. Okay. The other thing is the security of their information. Let them make sure that they protect their data and their information. And then the other thing is they need to know that that loan has obligations. So you must make sure that before you take it, you understand whether it's a 30-day, 90-day facility, and that you're able to repay. If you are unable to repay within the time, make sure that you understand whether there is a way to contact that financial provider and see whether you can negotiate an extension or another payment plan. And if that happens, if there is a cost to that. So what I would advise consumers is to understand this is a contract they're entering into where they really need to understand the terms clearly. And when they default on a loan, they shouldn't sit back. They should know that may have certain consequences. So they should try to contact, you know, the service provider to be able to manage their default or the consequences of default. The other thing is to players in the industry, I think they need to continue ensuring there's a lot of transparency in the products they are offering. They are able to offer consumers more information about these facilities. And to the regulators, I think there's a good space now to regulate on certain aspects and the issues that are in the market. And I believe that now we are going to see tractions and policy and more research in this area so that we can come up with a balanced regulation that can assist the industry.
Okay, thank you very much. Unfortunately, time is not on our side. Definitely a conversation that needs to be carried on online, just in line with the apps and the likes, because it's something that affects many people. Like you said, there's 7 million people who are taking loans online, some of whom are now becoming famous on the CRB books, unfortunately, about 500,000 of them. And so be careful. You've had the advice you've been given and the guidance in regards to what you need to look out for, what you need to ensure you need to do before you can take that loan. And we're seeing a number of people who are taking loans to bet. And we've seen the social ills that have been brought about by betting in a number of cases. But nonetheless, we shall continue to follow up a lot of this and have this conversation online as well. Thank you for joining me. Phyllis Kamau is an advocate of the High Court, and she's a corporate, commercial and regulatory policy lawyer. We also have Robert Masinde, the country manager of Zenka Finance Kenya, and Derek Kiea, investments analyst at Saiton Investments. My name is Dan Mwangi. Thank you for joining us on NTV Today. NTV Sasa comes up in just a bit, and today they're speaking about endometriosis. That's Jane Goiri and Doreen Majala. Be sure to join the two ladies and the team after this. Have yourself a great late morning into afternoon.